Samantala, makakapanayam po natin ngayon ang Infectious Diseases and Tropical Medicine Chief ng San Lazaro Hospital na si Dr. Rontgene Solante. Magandang umaga po sa inyo, Dr. Solante. Si Connie Season po ito kasama ang aking partner na si Rafi Tima.
Hi, good noon, Rafi and Connie.
Opo. Ayon po sa projection ng Octa Research, posible pong umabot ng 10,000 ang new cases kada araw sa mga darating na linggo dahil ho raw yan sa pagtaas ng reproduction na number o bilis ho ng hawaan sa Metro Manila. Ano po ang tingin niyo dyan?
Well, I hope it will not come because we don't want again this type or number of cases to be we're facing this large number of cases because we have experienced that before. But again, the reality here is that since the variant has already entered and there are already cases that has been documented locally, then that is not far-fetched that it may happen. And that's why our message here is it's not really to create fear, but to really advocate and always advise the public to be cautious and to always be compliant with the minimum health safety protocol that our government has somehow implemented for almost 1 year now. We should not be complacent, especially the gatherings, the unwanted gatherings, which are particularly super spreader events that can ultimately lead to this enormous number of cases in just a few days because of the high transmissibility of this Delta variant.
In your opinion, sir, ito ho ba kaya dahilan ng pagtaas ngayon ay maaring in connection with the Delta variant?
It's difficult to conclude that this is because of a Delta variant driven in number of cases. Even with the UK variant or even with the South African variant, which is also been documented now by the Philippine Genome Center here in the Philippines, then this can cause also the same trend of increase in the cases. And that's the reason why, whether we know that there is this variant of concern, it's just a matter of time that we really need. It's just a matter of time that any of this variant can be causing the surge of cases.
Opo, Dr. Solante, ano ho ba ang kaibahan kaya na katangian nitong Delta variant kung ikukumpara po doon sa iba? Kaya sinasabing mas nakakahawa at mas nakakamatay daw ito?
Well, ang characteristic niya ay nandoon pa rin sa spike protein. Talagang mas mabilis siyang pumapasok sa cells ng katawan natin. And in fact, the studies mentioned here that it can produce more viruses in one individual. And that's why there are reports of less than 10-minute interaction. You can already transmit the infection, especially if you're not wearing face mask, face shield, or you are in an enclosed space.
Opo. At maging sa mga bata, ito ay mas nakakaapekto na rin ngayon?
Yes, I would believe, because there are already data coming from outside of this country that there are new cases also in children. They are as vulnerable as adults, so that's why we need to also take care of our children. And I totally agree with the recommendation to really review that recommendation on letting the 5 years old and above go outdoor.
Opo, may mga nangangamba kasi na baka depende po daw sa brand ng bakuna kung kayang labanan ito pong Delta variant na ito. Ano po ang inyong reaction dyan?
Okay, so sa ngayon, we have to really emphasize this. Regardless of the vaccine brand, all of this brand can protect us from any of these variants of concern. So importante na pag i-offer na sa inyo ng LGU nyo ang mga bakuna, huwag na kayong hesitant. Tanggapin nyo na so that you can also help in terms of decreasing the transmission of COVID-19, particularly with this threat of Delta variant.
Opo, may mga additional questions pa si Rafi, sir.
Yes, Rafi.
Good morning po, Doctor. May kailangan hubang baguhin sa mga protocol? Gayong nabanggit nga ninyo, mas mabilis makahawa at mas shorter na yung period na makahawa itong Delta variant, lalo na sa mga enclosed spaces.
Wala tayong kailangang baguhin. The same protocol that the Department of Health and other authorities and clinical societies have recommended. It's just really a matter of complying, and somebody should be monitoring every now and then, especially in areas na binubuksan na yung mga establishments. So there should be monitoring of those who are in those establishments, the proper wearing of this health safety protocol, including ventilation.
Yung mga granular lockdowns po na ipinatutupad dito sa Pilipinas, mukhang epektibo kasi kung meron ng Delta variant dito at hindi naman ganun kadami, kung ikukumpara sa Indonesia, napakabilis nung pag-explode ng mga Delta variant cases po doon.
Yeah, I think the GCQ in general has been very effective of late, no? Because kung wala to siguro, I don't know what happened to us now. Baka mas mataas pa dito ang mga kaso.
Yung paghihigpit po sa mga quarantine protocols, lalo na sa mga borders, of course, isa ito sa mga ipinupula sa Pilipinas, isa tayo sa may pinakamahigpit na border control. Pero ganito na ho ba ang mangyayari going forward hanggat meron pang mga ganitong variant na lalong tumitindi?
Yes, because we know that most of the travelers are also higher risk of getting this infection, and when they come inside and travel and pass through these borders, then they can be a potential carrier or source of this infection.
So magpapatuloy pa po yung kumbaga ay patintero natin sa pagpapalago ng ekonomiya and of course yung prevention ng pagpasok ng mga bago at deadly variants.
Yeah, ang importante dito, no, at least we are slowly, hopefully makarecover tayo slowly, but I think the slow, medyo mabagal, pero at least we're moving in the right direction.
Ito bang lesson na pwedeng ipamahagi ng Pilipinas sa iba dahil yung iba agad na nagbukas nung bumaba na yung kanilang mga kaso pero tayo talagang hindi pa rin nagbukas ng fully ng ating ekonomiya for the longest time?
Yeah, I think nakikita na natin ngayon long term na meron palang advantage kung bakit nagkaganito yung mga policy natin na strictly we implemented yung pag-slow yung transition natin from GCQ to a modified GCQ. And this is driven by cases, driven by different other factors, including healthcare facility, number of patients.
Okay, salamat po sa inyong oras.
Thank you, Rafi and Connie.
Si infectious disease expert Dr. Rontgene Solante.
Maging updated sa mga maiinit na balita. Maaari pong mapanood ang Balitang Hali at iba pang award-winning newscast sa youtube.com/GMA News. I-click lamang ang subscribe button. Sa mga kapuso abroad, maaari po kaming masubaybayan sa GMA Pinoy TV at www.gmanews.tv.